guys, this is Caroline Peregrino. I'm a psychiatric nurse practitioner out of California. This is my third video in 3 days since I started my channel, and the reason I started this is I was inspired by a lot of newly grad nurse practitioners or still just in school nurse practitioner who are feeling inadequate, and I just want to be able to put out a video out there, and it seems like I had a really good response from a lot of people saying that it has been very helpful, inspiring to them. So I am inspired to put out more videos to help you guys throughout your nurse practitioner journey. By the way, this is my little baby Coco. So what we're going to talk about today is part 2 of the imposter syndrome. I think there's going to be parts and parts and parts of that, as we go along. But I want to talk about that today because I think that is a very prevalent challenge that we nurses have and most nurse practitioners have, especially after graduation. So just stay tuned. So let's really dig deep into imposter syndrome. So what I want to talk about is 2 parts. One is what is imposter syndrome, what symptoms or symptoms you are experiencing that says that you may have imposter syndrome, and the other part is what you can do about it. So before I go deep into that, actually, I kept stopping and going on my video, especially my introduction today, and I was going to talk about imposter syndrome, but I was not satisfied with how I was doing my introduction. So I kept stopping, deleting, and my 10-year-old son just went to me and said, "Mommy, it's YouTube. It's not a presentation. It does not have to be perfect." So the perfectionistic in me was happening while I have somebody who's watching me, a 10-year-old, telling me that it does not have to be perfect. So it was almost like a wake-up call to really accept that kind of feeling inadequate sometimes and that self-doubt, that it's okay. Just dive in. It doesn't have to be perfect, and it's okay. So, okay, enough about my story. So I want to talk about imposter syndrome. I experienced it myself. Sometimes I still experience it, as what happened today when I was creating this video. But new grad nurse practitioner, when I also first started, I had a lot of this, and it starts with self-doubt. When I looked it up online, it is defined as these feelings of inadequacy and self-doubt that makes you feel like you're an imposter, that you feel like you're a fraud, you're pretending, and what you know is not enough to show people that you are credible. So that is the summary definition of imposter syndrome. So what other symptoms usually do people have? Again, that feeling of inadequacy. You don't have enough tools, you don't have enough skills, you don't have enough knowledge or information about certain things. It could be medication, it could be interviewing skills, it could be, prescribing. So when you graduate, you feel so inadequate that you have all of those self-doubt, right? And most of it is normal to have those feelings, but sometimes it gets us to a point where it affects our quality of life and it affects our ability to do things in a much more kind of satisfying way. So number 2, we feel like we know nothing when we graduate as a nurse practitioner, like zero, nothing, zip. So because of that, it makes us, again, go back to that self-doubt. And I think it also comes from, we always hear new grad term, right? You always hear, oh, when you go to an interview, you're like, you're a new grad, you need more supervision, or you're a new grad, you need more experience. And it goes in our heads that, yes, we are a new grad, so that means I don't have any experience at all. And like what I said on my first video, that is not true. You come out with a lot of experience as an RN, and you do not want to invalidate that. Number 3, if you do know something, if you are good at one thing, you feel like you're just pretending and faking it because it's still not enough, and that you need to know 100% about certain issues. Does that sound like you? Because that is me, and that was me when I first came out of nurse practitioner school. Because of that, I felt like sooner or later somebody will find out that I am truly inadequate, that I'm truly actually stupid, and truly know nothing. And because of that, once they found out, then they'll fire me, right? You see the thought pattern there. And so when somebody complains about me, either a staff or a patient, then that makes me feel like, yes, now they're finding out that I really am inadequate. Does that sound like you guys? So that's definitely a hard way to practice as a nurse practitioner, because sometimes that causes us to people please, because we don't want to upset anybody, and that's not good, especially in our profession. There's going to be a lot of people that's not going to be happy because of the kind of treatment that we're doing in a way, right? I hope you understand what I mean by that. There's also perfectionism, meaning you won't do anything unless you are 100% sure that it will be a success, or you are 100% sure that you know about it. We also have a tendency to overachieve. So imposter syndrome, a lot of people with imposter syndrome has multiple degrees, multiple specializations, certificates, all of that, because we feel that if we don't have that, we cannot say anything about that certain topic, that we don't have anything to show for to say that, hey, I am an expert in that, because we could not believe it. So we have to have a concrete paper to show the world that we can say something about it, that we are adequate. I've got a little extra here. No, we know what we're talking about, okay? And we also can stand it when, going back to the other one, is when you don't know everything, and so you beat yourself up because of it. You have a notion that you should know everything once you graduate, and that anything there is to know upon graduation. And all of this together, I mean, how realistic it is, right? Is it really realistic for us to know everything and anything? I mean, just for example, right now in doing videos, I never thought I would do YouTube videos until, a few days ago, when I was inspired by other newly grad nurses to talk about, nurse practitioners, to talk about, about being new and what that means. So I did not know anything about YouTube. And if you were to compare my first video to my video now, I think it's a lot clearer. It's, it probably, you can see my face better. I have makeup on compared to that. It was just done after work. So, every single day I learn. And that's okay. Every single time that you see a patient, you learn. Okay? Patients give you a lot of tools. And that's okay. So it's okay to not know. Okay? So I want you to think about that for a second and see if that really, if that rings a bell. All of those things that I mentioned that are causing you to feel like you're inadequate. Now, what I want to talk about next is, what is it that you can do about it? Okay. Be realistic. Like what I said earlier, you cannot know everything and anything right off the bat. You have the basic knowledge, you pass your boards, right? You have the basic understanding, but implementation may not be completely better, right? Completely like 100% there. And that's okay, as long as you're not hurting anybody. Okay. I actually was working at doing my clinicals one time, and I was with a psychiatrist, and he's probably in his 70s at that time, and he's this well-known specialist in the area. and well-known psychiatrist, very nice guy. But he's been around because when I was working with him and the inpatient, he would write his doses in grains, and we would remind him that don't do that anymore. So that this doctor had been around. And I was doing clinicals with him, and he was talking to a patient, and a patient asked him about something, and my first initial reaction is he would know the answer. And you know what he said? And that blew my mind. He said, "I don't know, beats me." And I'm like, whoa. I know it's not like a huge statement, but that kind of slapped me in the face and woke me up to show me that even though someone has got that much experience, it's okay for him to say, "I don't know." It's okay for him to say, "Beats me." So that really made me realize that it is totally okay to not know everything, and to accept, or to tell the patient, "I don't know." It's completely okay. Be patient. It is a process, one patient at a time, one day at a time. You probably have heard that, being a psychiatric nurse, but it is very true in our profession. Okay. Let me look at my list here. Recognize all these feelings, and it's okay to sit with that discomfort and recognize that, yes, I may not know everything at this moment, but eventually, as I continue working, I will gain all the necessary skills needed to function as a very good psychiatric nurse practitioner. Make sure you get a good mentor. I think I cannot emphasize that enough. To have a mentor, this is separate from a collaborating psychiatrist. Somebody who's also a nurse practitioner who has a lot of experience under their belt that you can talk to, so that they can guide you both emotionally with all of this self-doubts, right? And validate you that it is okay, that what you did for this specific case is actually okay, right? That this is something that, normal, what you experience. Make sure you go to conferences. I think conferences, there's a lot of value in it. You get to network, you get to meet other people, and when they're talking, you go, "Oh yeah, I know that." Oh yeah, it validates your knowledge. And I think that's very important, because then that kind of make you feel like, hey, I do know something, right? And then it adds to your knowledge as well, which makes you more confident. Let's see. Sign up with a lot of pharmacological online classes. There's NEI, there's Simple and Practical, and I'll talk about it in the next videos. There's Psychopharmacology Institute. Sign up on all of them, because there's a lot of good videos, tidbits that you can learn from all of this, online websites. So that's really important. One last thing is, you guys need to be kind to yourself. Really be kind to yourself. Our job is not easy. Our job, every single time, day in and out, we're gonna talk about, really difficult things, personal things that patient, disclose to us. And it's not easy, especially as nurses, because we're able to kind of empathize, right? And sometimes take on, how they feel. So it's really important to be kind to yourself, and always ask yourself, if your patient's in front of you and they're saying, "I'm inadequate," what would you tell them? What would you say to them? You'd probably be kind to them and tell them that's, of course you're not. So I want you to put yourself in that situation and tell yourself that, yes, it is okay. And yes, I will, as long as you're willing to learn, as long as you're willing to do things that, that will improve your knowledge and skills. I think that is enough. When I was starting out, I did a lot of, researching, a lot of looking at journals, reading up to date, reading style. I mean, I'm not putting myself to grueling research, like for 3 hours, nothing like that. When a case comes my way, then I look it up. Okay, do your due diligence still. So I think that's long enough. This is a very long video. I'm so sorry about that, but I think it's something that needs to be talked about. And I really appreciate you guys for being so kind and really warm in your comments on Facebook. So I'm hoping that you subscribe to this channel, like the channel, and maybe hopefully you can learn some more on other videos that I'm going to be posting. I want to talk about, interviewing skills, borderline personality disorder. That's one of my favorite topics, actually, and also perinatal mental health. That's one of my specialties, so I want to talk about that and be able to give you some insights and knowledge and skills so that you guys can be confident when you are faced with patients in front of you. Okay, and just be confident as a nurse practitioner. Okay, if you've got any questions, just email me, or PM me on Facebook, or comment here, and I can definitely answer your question to the best of my knowledge and ability. And if I don't know it, I'm gonna tell you flat out, I do not know. Okay, and that's okay. All right, thank you guys. Bye.